first visit. During the first visit, it's important to gather all necessary information. Start by taking a complete series of photographs. This includes a full-face photo, smile, profile and close-ups with cheek retractor frontal in and out of occlusion, one with shade guide left, right and both occlusal planes. Take a high-quality impression, such as improgum, from the upper and lower arch and a bite registration. If the patient has any specific demands, write them down. Selection of the veneers. You need 2 models per arch, one to mock the reshaping and simulate the placement, and one to actually do the reshaping on. Write down schematically where and how you have reshaped and or sliced, and which type and size veneer you used for each tooth. When selecting the veneers, try to use the same type of veneer on one tooth and the same tooth in the other quadrant. A different size may have to be used left and right, and sometimes even a totally different veneer. Here, for example, veneer 14 is used on tooth number 24. You may also interchange premolar and canine veneers, or even central and lateral veneers, if different sizes or shapes are needed. Do the reshaping and fit the veneers on the second model as you would on the patient. If necessary, you can do some reshaping on the veneers as well. Only do this for the interdental spaces if the return is too important. Leave the adaptation of the length until after the placement. When reshaping the veneers, apply only little pressure. Second visit. Do the reshaping on the teeth as prepared on your model. Check the fit of the veneers on the teeth. If necessary, do some more reshaping. Always start with the placement of the 2 centrals to get the midline straight. Use a diamond burr type long preparation, black ring to roughen the teeth and prepare them for bonding. To adapt the line angles, you can use Softflex discs. Continue to roughen and reshape the teeth. Use a diamond disc, a yellow ring on straight hand piece, to separate interdental spaces if needed. If reshaping of the veneer is necessary, use a white rubber wheel on straight hand piece, low pressure. The other veneers will have to be checked for fit again before placement. Disinfect only the veneers you are about to place. Etch the veneers with hydrofluoric acid for 20 seconds, rinse thoroughly for 10 seconds and then dry the veneer. Apply silane and allow it to dry for 1 minute. Remove any excess silane by drying gently. Apply bonding, again removing any excess by drying gently, and cure the veneer for 3 seconds with a fast-curing Ramacure light. Etch the centrals with phosphoric acid for 40 seconds, then rinse thoroughly for 10 seconds. Polish the teeth with a brush and pumice, then roughen them with a black diamond preparation burr. Place metal strips distally from the two centrals to prevent etching and bonding on the laterals, which would make cleaning of the cement more difficult. Make sure the teeth are neither too wet nor too dry before applying bonding. Cure the bonding for 3 seconds. Remove the surgical light before placement to prevent the cement from hardening before you cure it. Use a light curing cement. This will give you enough time to check the fit of the veneer before curing it. Take into account that the space between the tooth and the veneer may be larger than when using custom-made veneers. Use enough cement to prevent air bubbles underneath the veneer. If a veneer would need some rebasing, you can mix some hybrid composite with a luting cement to do the rebasing at this stage. You can remove some of the excess cement with a brush to check the gingival fit. Before curing the two centrals, face your patient to make sure the midline is straight. If the length of both veneers are not identical, you can adjust this in the end when all veneers have been placed. Apply light pressure on both teeth with the back of an instrument and flash cure the gingival part of the interdental space to achieve a gel state of cement. This allows you to easily remove the excess cement with a probe. Always keep the point of the probe away from the veneer to avoid lifting it or getting air or saliva underneath it. When most of the excess cement is removed, cure each veneer for 3 seconds. Clean the interdental spaces with a Cerissaw and dental floss. This process may cause bleeding of the gingiva. For this reason, We recommend placing the canines first, allowing the gingiva between the centrals and laterals to stop bleeding. Before placing the other veneers, make sure there is no luting cement on the neighboring teeth. Fit the veneers on the canines and if necessary do some more reshaping. The procedure remains the same as for the centrals. After placing the canines, place the premolars. If the gingiva would continue bleeding, use a 3% hydrogen peroxide solution to stop the bleeding. Do not use Expasil as it may cause discoloration of the veneer. We recommend placing the laterals last. You may have to do some more reshaping on the laterals, neighboring teeth or veneers, or even do some slicing. In some cases, you will find that you need to use a different, often smaller veneer. If this is the case, write it down in the patient's file so you know which veneer to use if ever it would need to be replaced. Repeat the luting procedure. When all veneers have been placed, do a final curing on the buccal and palatal or lingual side. Polish the palatal side of the teeth and remove any excess cement. Do the final adaptation to the length, incisional embrasures and line angles where necessary. Control the occlusion, protrusion and lateral movements with occlusion paper. Remove pressure points on the veneers. Before finishing, check the occlusion, protrusion and lateral movements again with the patient sitting upright. Take your time. Going over it too fast may cause veneers popping off and causing you and your patient a lot of unnecessary stress. Polish all areas that were reshaped. Put all the necessary information, such as the color, type and size of the veneer, in the patient's file. To finish, take another full series of photographs. Give the patient a control appointment in 1 week to check on the occlusion again.